The facelift procedure is something for patients who started to show some signs of aging, typically where the soft tissue has descended a bit, where there's laxity or redundancy of the neck skin. Oftentimes it's the neck that gives away our age. So patients come to me to discuss those issues, and then we talk about a facelift, which involves lifting the neck tissues. It's done through incisions that are placed around the ear. Allows me to lift the tissues and take away excess fat, take away extra skin, and tighten the deeper tissues of the face that actually gives longevity to our result. The goal with the facelift is to set back the clock about 10 years. And in doing so, patients will always look about 10 years younger than their peers. The aging process continues. Some patients do come back for a secondary facelift. They may have had a facelift 10, 15, 20 years ago, and they come back to rejuvenate things further. The tissue under the skin is called the SMAS, S-M-A-S, and that's the tissue that needs to be lifted in order to give longevity to the result. You see some surgeons who take out some of the SMAS or lift it down on top of the bone. I don't do that. I don't think it confers a great deal of benefit. I think it does involve a great deal more risk. So the surgery I perform is in an effort to give the result that we're looking for with as little risk as possible. And so I do something called a SMAS plication, where we take that deeper tissue and it's hiked up or lifted up with permanent sutures that are placed within it. They hide underneath the skin. They restore some volume to the cheek, tighten the tissues along the jawline, and have a tremendous effect on tightening the neck. For a facelift, patients come in for the initial consultation. And rather than me talking and going through a lot of details, I let the patient talk and tell me what it is that he or she is looking for. I think having the patient define the goals helps me to tell them what's possible and to tailor the surgery to specifically what they're looking for. Most of the time, patients are largely concerned with the excess tissue of the neck and along the jawline, and that's where we start talking about the details of a facelift and what can be done. Removal of skin, removal of fat, tightening of the deeper tissues, all those things that can be done in an effort to treat the aging process and the aging issues that they're experiencing. The facelift procedure here at our new facility has really changed the process for patients. It makes things much easier. Patients, when I used to do these at the hospital, would come in, their blood pressure was high, they were anxious. Now it's a very calm environment, and patients have told me they've really enjoyed it much more. I do facelifts in the operating room. I do heavily sedate patients in order to do it. I think that's the best way to do this surgery. I like to do it in the operating room where I have staff that knows how to help me. I have appropriate lighting, I have appropriate instruments. I think it gives me the opportunity to produce the best result.